Hi, I'm Dr. Jeff Donatello, and welcome to our webinar on stem cell therapy and stem cell derived therapeutics. I'm the clinic director here in Portsmouth, New Hampshire. We also have an office in Bedford, New Hampshire, and we've been working with people who are struggling with joint pain and chronic issues with regenerative biologics now for close to 5 years, and it's at a point where it's really working well, but it's confusing because things are changing at the speed of light in that we're learning more and more. So there's all these different types of regenerative biologics on the market, and it's my job in the next 20 to 30 minutes to explain what that means for you as a consumer, because you really have to ask questions. And part of what I do, not only have we had 2,000 patients go through these therapies here in our offices in Bedford and Portsmouth, New Hampshire, but I work with doctors all over the country to help them teach people how they can best help themselves, because people are struggling in this day and age, post-COVID. There's a lot of pain, there's a lot of inflammation, and we're gonna talk about how we can help you get back to life again. So take a second. If you're watching this, you're obviously struggling, or maybe someone you know or love is struggling, but take a second and think about what has the pain you're experiencing right now cost you? Because we hear all the time stories of people that can't use the second floor of their house because they can't climb the stairs from their knees or their hips are killing them. Maybe they can't play golf, they can't walk the beach. Grandkids, you wish you could play with your grandkids again, but you really can't get around, you're not mobile. We hear stories over and over again of people who can do those activities, which is really an amazing thing to be part of, and that's why we do what we do. So what is your most precious commodity? I hope that it's your health, because if you don't have your health, and people take their health for granted, once your health goes away, you really don't have a lot. We're here to give you your health back and have you be the vibrant, energetic individual that you once were. So let's talk about healthcare post-COVID in the United States today. You have an ailment that isn't going away, and usually it becomes chronic in my mind if you're over the age of 45, 50, around 6 months. If that pain is still there, and believe me, I suffer from chronic injuries myself. If it's there at 6 months, 8 months, 9 months, it's not gonna go away probably without intervention. So typically what you might do in this country is you'll go to your doctor, and if you look at this slide, our doctor has a little goatee, and he or she probably cares a lot about you. But the problem is they're limited in their scope on what they can do to help you with your mechanical issue, right? Especially with arthritis or chronic tendonitis, cartilage issues, things like that. But they do their best, and they'll send you, maybe they'll send you off to an orthopedist who will inject a corticosteroid, right, into the joint. Maybe another steroid into the joint. And they get to a point where they're kind of frustrated. And in the United States now, the average person is taking 4 medications, 4 in the United States. So let's say they've done steroids and they've done all the drugs they can do, then they're gonna talk surgery. And you're like, I don't wanna do that. And now this is why you're watching this. For knee replacement surgery, over 20% of those surgeries fail. So nobody wants to go through surgery. It's a last-ditch effort. And I'm not anti-surgery. Some people need that, okay? But we've had over 300 people that have had scheduled knee or hip surgeries, replacements, cancel them. Now think about that. That means they've had it, they've scheduled it, they're ready to go, and they get these regenerative therapeutics put in them that we'll talk about in a second, and they don't have to have it done. So that's a wonderful thing to be part of. So here at the Center for Wellbeing, you come in, you have an exam with one of our nurse practitioners, they do a regenerative treatment on you. Purified amniotic fluid is what we're using now. It's amazing. We're going to talk more about it in a second. It's all under ultrasound guidance, and then they put a Band-Aid on it, and you're good to go. And you know, again, I always put myself in your position. You go, yeah, that sounds great if it works, right? But everything we do here is results driven. All right, after 5 years and over 2,000 patients, 90% of our patients get 60 to 80% better in 6 to 12 weeks. It's important that you understand that. The vast majority of people are going to do very well in a short period of time. I always say this, after 5 years, and if you're watching this, you could be anywhere in the world because it's on the internet, right? We live in a small town in New Hampshire. I always say that we would be driven out with a mob of pitchfork people chasing us down the road if we didn't get consistent results. So this works. I think, and this is very important to understand, what we've learned is over the years, the general health of the person is really, really important. The results we didn't get in the past was because probably we accepted people that had comorbidities, right? And going back to COVID, the sickest people, the people that died, right? We started to learn about this word comorbidity. Well, we already knew about it, but the general populace heard this word. And basically what that meant was they had type 2 diabetes that was uncontrolled. They were on lots of hypertensive medications, and they were overweight. So if we accept people as a patient and we want to regenerate tissue, but you have this pro-inflammatory thing going on, those are people that aren't going to get as good results, which is why we have a metabolic weight loss program, which some people, we may have you go through that first. Again, that's another whole presentation.
Hi, I'm Andrew Richard. I own F45 Training in Portsmouth, just right down the road from Center for Wellbeing. I originally made friends with Jeff because he was working out with us. He noticed me limping around the studio on a regular basis, and we had a conversation about my chronic pain. My knee was constantly hurting, impeding my sleep, activities, really everything, every aspect of my life. At nighttime, I literally I'd sleep for 10 or 15 minutes before I'd have to bend it, put it in another position. I was grouchy, I was tired, and I was, not able to enjoy life to my fullest. I came in here and connected with Jeff and the staff and received treatments, and, I think maybe 4 to 6 weeks later, it was honestly life-changing. I was back to activities, the knee pain was gone, I was sleeping, my family liked being around me more because I was less grouchy. And yeah, I tell everyone I know, it's honestly changed my life, brought me back to activity and sleeping at night.
So I'm here with Mark Gagne, and Mark was a patient that has turned into a good friend / mountain biking buddy. And we became friends in the office. And after he had stem cell therapy done, how many years ago was it?
My first one was exactly 2 years ago.
2 years ago. Maybe you can tell us why you had it done to begin with.
Sure. I had a right knee issue, torn anterior cruciate ligament, meniscus on the medial side was pretty much gone. So I was close to bone on bone. I had been scheduled by several orthopedic doctors to have joint replacement. They were actually coaching me to do it. Didn't feel right about it. I just didn't think that it was for me with my activity levels. And I researched what were my options. And I found the Center for Wellbeing. And I came in one day and had a consult and found out from Dr. Donatello that I was a perfect candidate for stem cell injection. So I signed up, went with it, and never looked back, actually. My activity levels have turned to pretty close to normal. Being my age, I'm 66.
Well, that's a point right there. Normal for what we do, because we ride mountain bikes now. And this is what the other day in the woods we were out there, and it was interesting. It was really awesome. You said something to the effect of, if it wasn't for the stem cell therapy, you would not be out here.
I wouldn't. I didn't have full range of motion. A lot of pain on climbing stairs and descending stairs, and so that's close to a pedal stroke. Up and down stairs, and
And how do we ride? We don't ride easy.
No, we don't. Jeff pushes hard, and I do too, because I have my standards, and I enjoy pushing it to the edge within my limits. But I work really hard at it, and I train very hard, and could never have been back to the level that I am now, both in the gym, hiking out in the California mountains, mountain biking with Jeff on weekends and during the week, whenever we can get away. We're on those bikes and we are pedaling hard. And I don't think that I would have been able to do that. Matter of fact, I know that I wouldn't have been able to do that without the guidance and the support from the center and my own body reacting and healing the way it has. And it's not the first stem cell injection I've had. I did it when I was in post-recovery from being hit by an automobile on my right side. I had massive scarring from 3 different surgeries, and he suggested that I try the stem cell in my arm as well, and I did, and I had a massive scar from about my armpit all the way down to just above my wrist, and the effects they're amazing. They were talking about doing skin abrasions and things like that to remove the scarring, but I didn't need it. I came back. I have full range of motion with my arm. I have very little pain. I have some numbness and tingling, but that's due to the ulnar nerve damage I had. But the scarring has cleared up dramatically.
Hi, I'm Derek from Portsmouth, New Hampshire here, and I heard about Dr. Jeff Donatello. I was having some serious pain in my knees. I played a lot of pickleball and was constantly icing them down, taking a lot of Aleve. I went and got a few other opinions, and it came down to like knee replacement or live on Aleve for the rest of my life. Well, I found out about the wellness center here, and I came in, and I was a candidate. They did an ultrasound on my knees. They shot them with some stem cell and some PRP mixed in there, and they said the results would be about 6 months. I had this done 3 months ago. Within 6 days, the pain went away. I still play 3 or 4 times a week for a couple hours a day. And the achiness, the tiredness that existed in my knees when I woke up, when I got done playing, is gone. And I'm very thankful to have found them.
So what got you here? Why do you have chronic joint pain? So if we look at this slide, you see a healthy joint and then you see an unhealthy joint, right? We see a knee on the left and we see a hip on the right. So how did those people get to that point? Well, a lot of times people think it's normal aging, and I'm here to tell you it's anything but normal aging. Of course, there's nature and nurture, right? The genetics you've been given and how they've been nurtured, very, very important. But let me tell you a quick story. I used to be a race director, and I had a 5K that we had almost 5,000 people do it. It was called the Elliott Festival race in southern Maine. And after one of the races, we had an 80 and over category, and I saw all the 80-year-old guys hanging out, having lunch together. I went over and talked to them. I asked them, I said, hey guys, how many of you have arthritis in your knees? Now these are men that did 20 to 40 miles a week at 80 years old. Many of them beat the majority of the field. They were that fast. How many of you guys have arthritis? 0, right? Why? Why is that? They've mechanically been pushing their bodies, right? Almost to a T, they ate well and they didn't have a lot of physical, chemical, and emotional stress in their life. And that's the common thing. So you have to look at it from a holistic, well-rounded standpoint. So what we're talking about here is degeneration, the state or process of decline or deterioration. Human beings age, we all know this. If we didn't die off as a population, we'd have too many people here and eventually we would die off. So nature has a way of going from young to old and then bringing back young to old, right? That's how it works. This is common sense. But there are ways to slow down aging. Regeneration, right? And how do we regenerate? How do we reverse it? The process of repair, renewal, restoration, and growth. How does that happen? Well, in the last 12 years, we've figured out that if we can decrease inflammation and we can use some of these regenerative biologics that I'm going to talk about, we can really make a huge difference in our patients. So let's do a little bit of a history here. Do you get the stem cells, right, from yourself, or do you use other types of regenerative biologics from a donor? That's really important because autologous means you use it from a donor, from yourself, and allogeneic means you use it from a donor. So we'll talk a little bit about what that means. In autologous procedure, you take your own stem cells, they're aspirated out of your hip, right, by an orthopedic surgeon under a C-arm guidance, right? It's an operative procedure, and then they're manipulated and they're put back into you at a later date. There are still doctors that are doing this, and maybe it's right for some, we choose not to. Using your own old cells that don't replicate anywhere near as quickly as what we're going to talk about. It's painful, long recovery, and in my opinion, we've had many people that have gone through these procedures, and it's minimally effective, and it's really based on your age. This is where it gets a little confusing. We use what was called Wharton's jelly. All right, these are mesenchymal stem cells, which we now realize they're not stem cells, they're signaling cells, okay, MSCs from the cord. All right, and what happens with the MSCs, they're live, they create an inflammatory cascade. It's the first step in healing an inflamed area. But really what they do is they wake up all the other regenerative goodies we're going to talk about in a second to finalize the healing through upregulating genes and creating new proteins. So what we learned, we made a switch about 2 years ago from using the MSCs to using purified amniotic fluid. So if any women are watching this, they've had a baby, you all know that that baby is bathed in this I call it a force field of protection. That fluid keeps that baby super healthy. It's how a woman doesn't transfer disease to the baby. It's how a baby comes out and its skin is perfect because it's loaded with these regenerative biologics with inside the mom. So the purified amniotic fluid that we use is potently anti-inflammatory. So what happens is it upregulates and downregulates genes and it creates new proteins. So this is not a cellular product, it's an acellular product. What we're working with here are called microvesicles. Picture a little box, right, that maybe a UPS carrier would bring to you full of 250 billion goodies. And those goodies are targeted at healing your tissue, okay? It's a mixture of microvesicles. These are microvesicles that have been ultrafiltrated and cleaned up by a third party under strict CDC guidelines. So a microvesicle, and there's 250 billion of them in this little vial, they're taken out and injected into their joint. A microvesicle basically is mRNA, right, which helps regulate genes, microRNA, which helps build proteins, and a bunch of lipids, little fats, food for the cells. And this is how your body heals. So what can purified amniotic fluid help? Well, it's been used to help meniscus tears, ligament tears, cartilage, tendonitis, rotator cuff repairs. And as far as the body parts, we love working with chronic inflamed arthritic knees, hips, neck, back, elbows, fingers, hands, anything that is chronically inflamed, that's what we can help the most. So some common questions people ask you, how long does it take? What is the process? Well, you come in for an exam with a nurse practitioner, she'll look at you under ultrasound, she'll get an idea what type of outcomes to expect, and then you'll come up with an idea of what body part or parts you want to treat. So you come back in the following week and they will basically go through the whole procedure with you, inject, and it takes less than an hour. Most people need one treatment, it's one and done. We have some people that years later will come back in for a second treatment, but what we found, it's kind of neat. If people come in and they get 60, 70% better and they get results from it, usually they're gonna go 70, 80, 90% better with that second injection over time, but no one really needs to have that second injection. So side effects, minimal. At the site of injection, you might have some irritation. We have about less than 2% of people might feel a little yucky after the shot, but it's a rare thing. Let's talk a little bit about bone on bone, because everybody that comes in here tells us they're bone on bone. Out of the 2,000 patients we've had, they're all bone on bone. What happens is you want to realize that the bone on bone we're talking about is not a fused bone. It's just an articulating surface. And it can be fused, right? That's usually someone 10, 15, 20 years down the road. If you've ever seen a really older person where they can't use the joint at all, that's a fused joint. We can't help those people. But for most of the time, the people that come in here, as long as that joint isn't fused up and it's bone on bone, we can help them. So who performs the treatments? Well, we have two excellent nurse practitioners. One's in our Portsmouth office, the other's in our Bedford, New Hampshire office. And as you can see here in the video, Crystal DeZorbo and Tandi Delawe are awesome at what they do. They've been trained and they have a lot of experience doing this. We always get the question, does insurance cover it? I wish it did. I want to read something here on your screen just so you understand the frustration that we feel too. This is from Medicare Guidelines, section 2251.3, and it says, in the Medicare Guidelines, a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or a therapy that is performed to maintain or prevent deterioration of a chronic condition is deemed not medically necessary. That's a sad state of affairs. So that's where we're at. So remember, this is a system where you're given drugs, and this falls outside of that scope, okay? The purified amniotic fluid that we use is a secretion. It's categorized as in the same category as a breast milk. It's acellular, and it's an amazing way of doing it, but it's not an insurance-based procedure. So what is your next step? If this interests you, my best advice is to come in and talk to us, really get a feel for what we're all about. And we can give our best recommendations. If it's something we feel we can help you with, our nurse practitioners will tell you that. If they feel they can't help you, they'll tell you that too. Some people come in and they're metabolically inflamed, they're heavily overweight, and they're just not healthy people. Those people go through our metabolic weight loss plan and their results later on down the road are exponentially better. So again, every body's different, but I always like to throw out the cost. It's $4,600 to do one joint. It's $8,600 to do two joints. So if you did both knees, it would be $8,600. We take flexible spending accounts, and different ways of financing the care can be done in our office. So I hope this was interesting. Once again, my name is Dr. Jeff Donatello, Clinic Director at the Center for Wellbeing in Portsmouth and Bedford. If you want to learn more, go to centerforwell.com or give our office a call at 603-380-9159 to set up an appointment where we can sit down with you and really get an idea if we can help you out. It's my hope that this webinar was informative and that we can help change your life in the near future. Have a great day.